Hello everyone, Assalamu alaikum. This is me Faraz Gurban Rajpar, and in this video lecture I am going to discuss with you about the medicinal chemistry of those drugs that are used in the treatment of the TB, that is the tuberculosis. Tuberculosis, as you know, that is one of the most prevalent infectious disease that is caused by one of the infectious agent, that is basically the bacteria, that is the Mycobacterium tuberculosis is the causative agent of the TB. And according to the WHO report, over 2 billion people worldwide, and the 30 million new cases are being reported each and every year about the TB. And it is the intracellular infection that is responsible to cause the death of 3 million people annually across the globe. The main symptoms of this infectious disease are the cough, tachycardia, cyanosis. Tachycardia is usually the increase of the heart rate, heartbeat. Cyanosis is the bluish coloring of the skin, and in the end these all will cause the respiratory failure. The common infectious site of the TB are the lungs. That is basically the primary site for this infection. Means the mycobacteria mainly attacks the lungs, and the other sites can be the brain, liver, bone, kidney. And on the type of location of the sites or the infection caused by mycobacterium, the various organs, it can be classified under different medical terminologies. Like pulmonary tuberculosis is that type of TB that is only related to the respiratory tract. Means in this mainly the lungs are being infected and they can lead to the respiratory failure. The other type of TB in which the Mycobacterium tuberculosis attacks the different other organs apart from the pulmonary organ or the respiratory organ. That TB is known as the extrapulmonary TB. Among that, the examples are the genitourinary TB that is going to infect the genitourinary tract, and the meningitis that is attack the nervous system, and the malarial tuberculosis that is a widespread infection that is caused by this infectious organism, that is the Mycobacterium tuberculosis. TB can also be termed as the latent TB. Latent TB is that type of TB when the infection is caused by the Mycobacterium tuberculosis, but the patient do not have the symptoms. So in this, basically the patient is being infected with the infectious agent, that is the Mycobacterium tuberculosis, but the patient does not have any active TB symptoms. And about 10% of the latent TB infection in which the patient do not have these symptoms may lead to the active TB, in which the different symptoms like the tachycardia, like the other cough and other symptoms of active TB appears, and they can lead to the further advancement of the disease. The other classic symptoms of the TB are the chronic cough with the bleeding in the sputum, and this may have the patient may have the fever, night sweats, and the weight loss. So these all are the symptoms that are present only in those patients that are having the active TB. On the other hand, latent TB do not have any of these symptoms. So this is the latent TB infection, this is the active TB infection. So in this diagram you may observe that the infectious organ the infectious microorganism, that is the Mycobacterium tuberculosis, has infected the organ, but the patient do not have any type of the symptom. So latent TB means the TB germs are present in the body but not enough. Means they are what we say, they are not widely spread, so that's why they do not have the ability to cause the sickness or to cause the active symptoms. On the other hand, in the active TB you may observe that the microbe has been spread throughout the organ, so that's why the infection is become active and the patient have the symptoms. Tuberculosis as can be the contagious disease because it can be spread through the air in those people who have the active TB. Clear. So whenever they speak, sneeze or respirate, so they can be responsible for the carrier of this microorganism to other patients who do not have the symptoms. So people with latent TB usually do not responsible for the spread of TB because they do not have any of the symptoms. Active infection mostly occur in those patients who already have the weak immune system, like those who are having the immune disease, like those patients, the patients of HIV, AIDS infection, or the patient who smoke more may have the more chances of active TB infections. The active TB can be diagnosed on the basis of the chest X-rays as well as the microscopic examination, and the culture body fluid diagnosis of the latent TB on the other hand relies basically on the two type of tests. One is the blood test, other is a tuberculin skin test. Pathogen of the tuberculosis. Mycobacterium is the genus of the actinobacteria. Actinobacteria is basically the family name of the Mycobacteria. So this genus includes those pathogens that are responsible to cause the serious diseases in the mammal, including the Mycobacterium tuberculosis, leprosy that is going to be caused by another species that is the Mycobacteria leprae in the human. So on that basis, the pathogen Mycobacterium tuberculosis, let's discuss its structure of its cell. Start from the cell wall. Gram negative have the cell wall that is made up of the thin peptidoglycan layer and that underlines the plasma membrane, and the outer membrane of which is mainly composed of lipopolysaccharide, and we know that they have the antigenic properties. The cell wall of the gram-positive bacteria of this genus is basically composed of thick and peptidoglycan layer, and this is the adjacent to the plasma membrane. So this is the diagram for understanding the cell wall of the Mycobacteria. You may observe this contain the different layer of the biological molecule. Some of them are the protein molecules that are basically the linkages of the peptidoglycan. You may observe there are the sugar molecule present in the cell wall of the Mycobacteria that are nothing but the arabinogalactin. Arabinogalactin are the sugar molecules that are present in our carbohydrate molecules that are present in the cell wall of Mycobacteria species. And after that there are again the lipid, or what we say fat molecules, that are the mycolic acid. So you may observe that the outer wall, that is the cell wall, is basically composed of the different type of layers of the macromolecule that are the peptidoglycan, arabinogalactin, and the mycolic acids. This is again the other diagram for your understanding that this is the cell membrane. Inside the cell membrane, the space is the intracellular space, and after the cell membrane, you may observe this is the entire is the cell wall. Cell wall is made up of peptidoglycan, and peptidoglycan is nothing but the layers of the peptide and glycan that are the sugar molecule, and the arabinin and galactin combined to form a condensed molecule that is the arabinogalactin. Mycolic acid are the fat, are the what we say the cholesterol, are the fatty acid molecule. So they all basically combine in a unique fashion and they form the cell wall of the Mycobacterium. Its structure is important because in order to understand the mechanism of action of the different type of anti-TB drug, where you may observe that they will act on the synthesis mechanism of these different type of macromolecule. Now let's start the different type of drugs that are used in the treatment of the TB. Starting from the very basic that there are different type of drugs that are useful in the treatment of TB, and they can mainly classified in the two categories. Some are the first line drugs, some are the second line drug. Among the first line treatment of the drug include the isoniazid, streptomycin, rifampicin, ethambutol, and pyrazinamide. The second line drug treatment of the TB include the ethionamide, pyraminosalicylate acid, ofloxacin, ciprofloxacin, cycloserine, amikacin, kanamycin, viomycin, and the capromycin. Mainly this include the fluoroquinolone antibiotic. After that, you may observe basically this first line and second line treatment of the drug is depend on the duration of the treatment. Majority of patients with the TB are being treated with the first line of the drug, and they show the excellent result within the 6-month course. So normally the 6-month course is required for the treatment of the active TB. For the first 2 months, mainly isoniazid, rifampicin, and the pyrazinamide are used, and in the remaining 4 months, followed by the isoniazid, rifampicin are used. The second line drugs are mainly used for the treatment of those TB patients who are resistant, who are multi-drug resistant, means in which the different drug have become resistant. Now let's discuss the drug of the anti-TB, that is the isoniazid. Isoniazid is basically the prodrug, means it itself is not an active drug, so it must be activated somewhere inside the body to convert it into the active that will have the pharmacological action. So basically this prodrug is being activated on the surface of the Mycobacterium tuberculosis by the KG enzyme, and when it is activated it gets converted into the isonicotinic acid. So this isonicotinic acid is basically responsible for the pharmacological action. How? Because it is going to inhibit the synthesis of bacterial cell wall, that is the synthesis of mycobacterial cell wall, where it will inhibit the synthesis of mycolic acid. We know that mycolic acid are one of the important fatty acid molecule that is present in the mycobacterial cell wall. And that's why now as mycolic acid synthesis is being inhibited, so its sensitivity towards the reactive oxygen radical is being enhanced, because the KG enzyme has a role to act as a catalase and the peroxidase. And as now the mycolic acid is being synthesis is being inhibited, now the reaction towards the oxygen radical and the oxidation has been enhanced, and that's why this cell wall is now being denatured. So in some of the mycobacterial species mutation occur, and due to the mutation resistance to these drugs can occur, those drugs which are basically acting on this type of cell wall. So due to both its catalase and peroxidase enzyme, this enzyme which that we have KG enzyme protects the Mycobacterium tuberculosis against the reactive species. But once the drug has been given, this drug will ultimately cause the inhibition of mycolic acid synthesis, that is the isoniazid. So isoniazid may act as the bacteriostatic, or it can have the bactericidal effect depending on the concentration of the drug that is given at the site of infection and the susceptibility of the microorganism. The drug is active against the bacteria only during the cell division. Let's discuss the synthesis of the isoniazid. This is the actual part of medicinal chemistry of the anti-TB drug. So synthesis of isoniazid will start from the basic precursor molecule, that is the 4-picoline. 4-picoline is basically you may draw the pyridine ring and place the methyl at this para position. So this will become the structure of 4-picoline. So when this 4-picoline is going to react, it undergoes through the oxidation reaction in the presence of oxidizing agent, that is nothing but KMnO4. And so after that, this methyl group that is at the 4th position will oxidized and converted into the corresponding acid. So now you may observe this resultant acid derivative of 4-picoline will be formed as a result of oxidation. In the next step, this will undergo again through another type of reaction where what is basically happening, this our acid derivative will convert it into the ester derivative. So basically the esterification of this acid derivative will occur in the presence of ethanol, and sulfuric acid is used as a catalyst. So now what will happen, you may observe that this C2H5OH, this is the ethanol molecule, this will get substituted at this position and now its ester derivative is formed. After this, in the next reaction, this is reacted with the hydrazine. Hydrazine is that in which two nitrogen connected by the double bond, and now ultimately the isoniazid will form. Isoniazid is basically the isonicotinic acid hydrazide. So this is the structure of isoniazid drug that is acting as anti-TB by inhibiting the mycolic acid synthesis. Simply pyridine ring and again the C double bond O NH NH2. So basically this is the isonicotinic acid. This is the isonicotinic acid hydrazide because this hydrazide is present. Metabolism of isoniazid drug. So now let's discuss how this isoniazid is going to be metabolized and converted into its different active and inactive metabolite. For the metabolism of isoniazid is metabolized into active metabolite and its major active metabolite, like some are the inactive, the N-acetyl isoniazid. The enzyme that is responsible for its metabolism is the N-acetyl transferase that is causing the acetylation of the isoniazid drug. After that, the other metabolite can be formed, that is the isonicotinic acid, which is found as in the urine as a glycine conjugate, means that is undergoing through the phase 2 metabolism with the glycine, and the other are the hydrazine. Isonicotinic acid may also result from the hydrolysis of acetyl isoniazid, but in this case second part of hydrolysis is the acetyl hydrazine. Acetyl hydrazine is again may have affinity to undergo through the acetylation by the N-acetyl transferase and will get converted into the diacetyl product, which is basically the diacetyl hydrazine, but it is completely inactive. This acetyl hydrazine that is converted into the diacetyl hydrazine may be converted by the hepatic macrosomal to a reactive metabolite that are the hydrazine, and these are basically responsible for causing the isoniazid induced hepatotoxicity. So isoniazid induced hepatotoxicity reaction that is being occurring in some of the TB patients who are taking the isoniazid drug is because of this diacetyl hydrazine derivative and its metabolic inactive product. So this INH is basically isoniazid nicotinic acid hydrazide. So now let's discuss the chemical reaction mechanism of the metabolism of isoniazid. This is the chemical structure of isoniazid, that is the isonicotinic acid hydrazide. So during metabolism it may be by the acetyl transferase enzyme. After that it will undergo through acetylation and get converted into the acetyl isoniazid. You may observe at this NH side acetylation is going to take place. So in this red part of molecule is indicating the newly substituted pharmacophore or the group in this molecule, that is the acetyl. This is the acetyl isoniazid. In the same way, it can be converted into the hydrazones different type of hydrozone depending on the type of the R substituent. That can be the pyruvate or the ketoglutarate. And so this is over here are pyruvate or the ketoglutarate substrate can be present, that are basically the hydrazone of pyruvate and the ketoglutarate. This acetyl isoniazid can have the affinity to form the hydrazine molecule or the isonicotinic acid. So this will get converted into the isonicotinic acid by the deacetylation. And isonicotinic acid can undergo through the phase 2 metabolism with the glycine to form the conjugate. On the other hand, it can again converted into the acetylhydrazine. So one part is going to be converted into the isonicotinic acid, and the remaining molecule part is known as the acetylhydrazine. Now this acetylhydrazine can have the affinity to undergo through the again acetylation by the acetyl transferase enzyme. So now a second acetyl molecule will be introduced in its structure and diacetylhydrazine will be formed. In this you may observe this is the acetylhydrazine, this is the hydrazine part, this is the acetyl C-CH3. Only one of the acetyl group is present, but in the deacetylation, again diacetylation, the second acetyl group is being introduced. So you may observe this is the diacetylhydrazine. So now this is more active and this has the affinity to cause the hepatotoxicity that is being occurring with the isoniazid drug. So this is basically one of the most important metabolic pathway for the metabolism of the isoniazid. So now let's have the quiz for your self-assessment. Question number 1. Enlist the first and second line anti-TB drugs. Number 2. What is the mechanism of action of isoniazid anti-TB drug? Question number 3. Briefly discuss the metabolism of isoniazid. Over here you have to just mention the different type of metabolites that are found during the metabolism of isoniazid.